This year, we're here to celebrate the many achievements of the 7,000 people in our organization who have helped made the progress possible. Our patient experience advisors, staff, physicians, volunteers, and members of our community together, we have really taken the words of transforming the patient and family experience to heart and delivered concrete results that are making a difference each and every day to patients who come to KGH for care. I invite you to read KGH This Year. It's a fantastic set of highlights of the many accomplishments and achievements made by people within KGH. This year, it's been put together a little differently. It's really describing the metrics and the progress that we're making, all in relation to the journey of the patients. And you're going to be able to hear and follow that every step of the way. We're proud of looking through the lens of the patient as a way of describing the many activities that are happening, and invite you also to listen and hear firsthand from some of our team who are making it possible.
We're partnering with our patients and families in new and exciting ways. We're trying different initiatives to encourage our patients and their families to receive the best possible care. An example of this would be the Hospital Elder Life program, with which I am associated with. And we're trying very hard to engage our patients as part of the decision making in their care. We involve them as much as we can and their families. We allow them to tell us what it is that they would like to participate in. It's very important. We see that better patient outcomes if instead of us doing for them, that we do with them the care that's provided here. As we move forward, we recognize that we've done some really good work, but we plan to expand further with our patient and family-centered forums, our recruitment tools, all kinds of initiatives to ensure that our future remains bright and that we continue to move forward and develop new initiatives to make it better here at KGH.
So one of the goals in the emergency department this year is to eliminate any preventable delays in care. The challenges we face in the emergency department over the last few years is that we continue to see increasing volumes of patients, primarily people that arrive by ambulance, people with chronic medical conditions and complex problems. We have the same physical space, the same number of stretchers as we did sort of several years ago. So the challenge now is to find better ways of moving people through the system and getting people treated quickly out of the waiting room, get their tests done. KGH has investigated this and is committed to fixing the problem. I'm optimistic that they'll be successful. They've identified a lot of old processes and inefficiencies that we can change. And I'm really looking forward to the next year where we're going to have pretty efficient patient care, and it'll be good for all our patients.
Here at KGH, we're making great strides to eliminate all preventable harm to patients, family, and staff. Some of the main ways we achieve that are through PIDAC training for all staff and environmental services, the introduction of 3 new auditing steps that we take place through managers, and the engagement of staff in those auditing steps as well. The cleaning components in the KGH is the first impression of the facility, gives you a peace of mind that the place is cleaner and brighter and provides a good environment for families to feel comfortable when they come into the KGH. KGH will continue its initiative to make the hospital cleaner and brighter for families and friends. This year we'll introduce additional training tools and auditing systems to ensure that we continue to improve.
KGH is invested in creating a healthy workplace for its employees. We now have a wellness center for staff, physician, and learners. At the current time, we have about 18 wellness champions, and they're from various departments throughout the organization, frontline workers that really serve as the communicators to inform us of what's working in terms of our health and wellness initiatives, what people want to see, so that we can really help to build a healthy workplace for our employees. We had a great start last year, and we want to keep moving forward with our initiatives. Our hope is to have a calendar of events for staff that will involve yoga, exercise classes, running and walking groups, and we really want to focus on continuing to build and promote the health and wellness of our staff, physicians, and learners here at KGH.
On behalf of the board, the senior management team, I'd like to offer my personal thanks to each and every individual who's helped made KGH This Year possible. It's our collective effort and a passionate commitment to our aim of outstanding care always that's moving us forward and making a difference to the lives of people that we serve.